Hello, are you new to CBT? Are you wondering where to get the appropriate materials? Have you written the test and failed already? Don't worry, you are at the right place. On today's episode, I'll be sharing with you one important topic that you need to know before you can write a test. And in addition to that, appropriate materials to help your CBT preparation. Most often, you get tons of materials and you'll be wondering, which one should I learn? Are the answers correct or not? All these things will be a thing of the past after watching this video. So kindly stay tuned and subscribe to the channel. Today, I'll be talking about Bristol Stool chart. I'll throw more light on this so that you get to know what that is, the use, then the classifications when it comes to those charts, because it's something that you need to know in your nursing practice once you want to work in the UK. So if you don't know this, it means probably if you come to the exams, you'll not be able to pass. So if you look on your screen, you can see a picture of the Bristol Stool chart where you can see type 1, type 2, type 3, type 4, type 5, 6, 7. Yes, so it's up to 7. This is a chart or an assessment tool for classifying stools or examining your stools. Now this helps to identify whether you are having constipation or maybe you are having a diarrhea as well. Another important use is that we can use this to see the effectiveness of certain medications. So for instance, if you're having constipation and we've prescribed laxatives for your treatment, based on your stool, we can see whether indeed the laxative is having the necessary effect that we expect it to have. So we can just take a look at your stool, then based on this chart classify that, oh, maybe you were once on type 1 but now you are type 3 or type 4. So that is how that is. Now if you look at the picture carefully, let me try and break it down for you. So if you look at type 1, they've written separate hard lumps like nuts. Sorry about that one. Then hard to pass. So the type 1 is extremely like extreme constipation. So if you're on type 1, it means that you are really constipated. Now know that the more you move from type 1 down up to other types, maybe from type 1 you go to type 2, it means that the more your stool is becoming a bit flexible. So once you move from the lower to the higher end, the more your stool is becoming more flexible. So if you are type 1 and you move to type 2, it means that the extreme constipation that you are having, for you to pass that stool is becoming less. So type 2 is sausage shape but lumpy. Type 3 is like sausage, then but with cracks on its surface. Wow. Then we have type 4. Type 4 is more like a sausage, or maybe others tell me that it's more like a snake. Do you get it? Then that one is a bit moist and it's soft. Yeah. Then type 5 is soft blobs with clear-cut edges. This one is easily passed. Then type 6, fluffy pieces with ragged edges, mushy stool. Then type 7, type 7 is watery. It contains no solids. Yeah. So type 7 is more of watery stool, diarrhea. That indicates diarrhea. So it means that from type 1 up to downwards, getting to 7, it means that your stool is becoming more softer until it becomes watery. So type 1 will indicate extreme constipation. Going up to 7, it means you are moving towards diarrhea or watery stool. So that is how the Bristol Stool chart works. I also talked about getting the right material for the CBT exams, and as you can see here, we have this Dank GH Ultimate CBT Guide. Now this is very powerful book, to be honest. Yeah, because a lot of people who have bought the book and used the testimonies that they are giving is so enormous. Now this is for mental health nurses. We have other ones for adult health nursing and midwives as well. So if you look at the book, it covers part A and part B of the exam. So part A, which is the drug calculation aspect, the book talks about the drug calculation, trial questions, formulas, and step-by-step approach in solving these questions. And it is easy to read, no big words, not complicated. Yes, so you can just get it on your own, do your own studies, and everything will be fine. Then we have trial questions in them. Once you get a book, there are trial questions for part A, where you can solve it yourself and compare the answers to the questions in the to the answers in the book. Then when it comes to part B, we have some selected topics, right? There are 10. That is for the mental health nurses and adult nursing. The midwifery is more than 10. Now these topics forms the basic foundation of the CBT exam. So if you don't understand these topics very well, it means that it will be difficult for you to pass the exams, honestly. So these topics are well explained in the book. Then with exercise, or what we call trial test on each topic. So assuming the topic is revalidation, then after that we will give you an exercise on revalidation for you to try your hands on, and answers are in the book so that you can refer and see that now you really understand what revalidation is. So that is what the part B is all about. Then after these topics, we also have test questions from test 1 up to 45. That is for the adult nursing. For the mental health nurses, it's more than 45. So for instance, this is test 8. So these are the questions. You try your hands on the questions, and there are answers given at the back of the book where, so this is it. So these are the answers. So this one, it says root cause analysis is the process of reviewing. So the answers explains the question and reason why certain answer was what selected. So that one is also in the book. And when you are done with these test questions, we have what we call the ultimate test 1 and 2 for the adult nurses and mental health nurses. Now answers are not given in the book, honestly. We want you to solve the questions, submit your answers to us so that we can review the answers and give you feedback on your performance. With that one, we can see that, oh, the book was helpful, you understood certain aspects of what we really wanted you to know. Then it also gives us the chance to give you a feedback that it's okay to take the test at this moment, or maybe you need extra support or maybe extra reading. So that is how the book is structured. So it's only available in a hard copy in the UK and in Ghana at the moment. We are making it possible to be online so that wherever you are, you can get access to the book and use it. So if you want a copy, just call the numbers on the screen, or maybe send us an email, dankcbt@gmail.com. Then we will make the necessary arrangement for you to get the book. Alright, so just look on the screen. We will draw some trial questions. Try your hands on them concerning Bristol Stool chart. Leave your answers at the comment section on YouTube. Then the team will review and give you feedback on your answers. Now, if there are other topics that you would want us to work on it for you, do a video on it and present it to you, you can just drop that topic at the comment section, and we will also look into that as well. Thanks for staying on, and we wish you all the best in your CBT exams. Bye bye.